Our next speaker is Dr. Lirk from the Department of Anesthesiology in the University of Amsterdam. Dr. Lirk told me that something you wouldn't know about him was that for a little while he lived in Milwaukee, Wisconsin, and he was working on some research at the time, and he absolutely loved the Midwest. Okay? Dutch people, whoops. Not yet. And then he wanted you to know about his country. Dutch people were some of the first people to come to the United States, and they came to Manhattan. And Brooklyn and Harlem are also names of cities in Holland, and they're probably pronounced a little differently, and I think I'm going to let you pronounce the Dutch way. So please help me welcome Dr. Lirk.
Very much, Associate Christy, for this wonderful introduction. Since I was born in Austria and moved to Holland afterwards, I would like to add a small something about the sound of music to begin on a light note before it becomes more serious. So one thing that most Americans don't know about Austria and the sound of music is that most Austrians don't know the sound of music. They have no idea what it is. So when I moved to Milwaukee, which was one of the greatest times of my life, I loved it here, I became completely engulfed in the sound of music. People were asking me all the time, so I watched the movie there for the first time at age 25. I fell in love, so since then I understand completely. And so now I'm in Holland, and we're also affected a little bit by the refugee crisis, and Dr. Osterbrink was so kind to supply a video that was filmed by European authorities, and there is a small intro, and then I will begin my lecture. You heard the beginning of the...
Is the health sector well positioned to affect the values, to demonstrate the impact that migration is having on the health status of these refugees? How are we doing from health to affect the other sectors?
We need more solidarity between East and West European countries and clear EU leadership.
What we face today in Europe is not a refugee crisis, but a reception crisis.
What we need is robust, coherent and bold action by the European Union and its member states and its institutions to regain control of the situation.
We see the conditions that people do in our consultations are caused by the migration routes that they have to take because of the European policies. People need safe passage. If we don't start with that, we go nowhere. And that's the most important thing. It's in our hands. And today, European policies are creating more problems than they are solving.
This is something that's developing as we speak. This is something that Trump, especially refugee crisis, healthcare, and all social and healthcare problems, is something that deeply affects Europeans, I think any European. And yesterday the main headlines in many Central European newspapers were the European Union is tumbling, just because we can't figure out a good, coherent way to do this. I would like to start with a very brief intro of the Netherlands, where I'm happy to live now. It's a little northwest of Austria. It has 16.8 million inhabitants, divided into 12 provinces, and it's a parliamentary monarchy with a king, and we have a prime minister. The king only has representative functions, such as maybe the president in some other countries, and when he gives government speeches, they are written by the parliament, so it's more maybe like some DBs, let's say like an actor who is playing what the government has written for him. The capital is Amsterdam, but the seat of government is The Hague, which is also the seat of many international institutions. We do have the royal family, and they are quite popular in Holland. But even though Holland is a monarchy, it's still a very progressive liberal country. So it was the first country to allow same-sex marriage with full rights. It was one of the first countries to legalize cannabis, which is a good idea or not, I'm not sure, but it was one of the first to do that. It was also one of the first European countries to really have a very active discussion about euthanasia, and Holland, some say, sadly took the path of diverting lots of attention also on euthanasia, on active help in dying. So the Dutch are quite peculiar in Europe, considering their political stances. One thing that people love about the royal family is that they get to celebrate the king's birthday every year, and that's in spring. And that is a huge festival where about 1.5 million people flock to Amsterdam. Everyone is dressed in orange, the traditional color. And it's also leads to the biggest traffic jam in Holland at that time, even on the water. So water is one very happy and very good way of transportation in Holland, and there is no shortage of water there. Most of the country is below sea level, I'll show you in a minute. The second thing to consider is that most of the big countries are actually 4 to 5 meters under the sea level. So our house would be completely flooded up to the second, third floor if the dikes broke, and that is one of the biggest fears of Dutch people, is that the dikes break. So this is a different map of Holland. So this is where the coastline is, and this is where the biggest cities are, and you see that Amsterdam, Delft, Leiden would be completely submerged in water where the dikes to break. And so lots of what Dutch people do and say revolves around water. So to dike is actually a Dutch way to discuss something very, very diligently, is to dike something. If you would translate it literally, and if a child is beyond its expiry date and it's just making a riot, like throwing himself on the floor in the supermarket and crying, then the Dutch would typically say, you cannot sail any more seas with him. So everything to do with water. And the second mode of transportation are bikes. And the Dutch invented the Dutch minivan, as some call it. So this is called a crate or bakfiets. And even the Prime Minister uses it. And this was a very nice graphic that President Obama was visiting Amsterdam last year, and there was a huge conundrum about how he came, and he came with a cohort of 8 Black Hawks and four armed helicopters and 2 Marine 1-2, and somehow this was how the Dutch Prime Minister arrived the day before. So they say it's a very small country, not that important, luckily. And this is a photo of my hometown Amsterdam, and these are typical small cafes. These are the cafes that people like to go to. They're called brown cafes because they were old, some hundreds of years old. And this is where I come to the refugee crisis now. If you attend any larger gathering of people, what I noticed is that in the last year, it takes about half an hour, and then you talk about refugees. There is no way this would have been that way 2 years ago. There was a politically sensitive topic. It was maybe like gun laws here, where I said, if I don't want to ruin the evening, I don't bring it up. Because there are people with very extreme views on it, I just keep out of it. And ever since the spring of last year, it's grown and grown and grown, and you cannot attend a gathering of more people without this topic coming up. So it deeply touches many, many Europeans and how they feel. And what the lady in the video said is it's not a refugee crisis, and it's more of a reception crisis. And I think the word is a little misleading. It's not a crisis of Europe primarily. It's a crisis of the poor people who are fleeing. So these are the poor people who are running for their lives, and we make it a European crisis. We say, oh, we are the poor ones because we need to take them. But that's actually not really the way it is. So these are the poor people, and we need to figure out a way to help them effectively, so that the whole refugee crisis is maybe a little misleading. Nevertheless, it imposes strain on European countries, and it creates unease and uncertainty. And you see, so that the last year, the number of asylum claims in Europe was about 1.3 million. And now you might say, now that's not too much because the EU has 500. Oh, that's nice. Because the EU has 500 million inhabitants. So it's 1.5 times as big as the United States. You should be able to do that. But then the fact is that the burden is not shouldered equally. And you see here that countries like Germany have taken almost 1 million of those 1.2 million, and they have only 80 million inhabitants. And then it becomes a different number. So this would correspond to about between 5 to 8 million refugees for the States if you would transfer it in size-wise. So that's a pretty sizable number. And how is Netherlands affected by this? So this is the nicest graphic. Unfortunately, it's in Dutch, but it says here it's 35,000 per year. So Holland has not really taken too many people. It's like an European average. What are the healthcare consequences? So the consequences for taking them, giving them shelter, giving them money to be on, because they get basic social security once they're there. It says here it's about 500 million euros per year for Holland. But these are 35,000 people, so new this year. So this will explode, this will become slightly more. Many of these people are obviously from Syria. And how does the healthcare reception work? So in healthcare-wise, it's typically that people come to a European country, and at the moment this is rather unorganized. So many people that flee the countries of the Middle East, they have preferences. Many of them want to go to Sweden or to Germany, and that's because there are large communities there also of people from the Middle East. So they feel more welcome. They have a social network there. So naturally, they don't want to get stranded, if you will, in Croatia, where they have no one, and social security is typically not that big. So it's an understandable thing. But the thing is, it creates waves of refugees through Europe that are not really controlled, and that are not actually to what the treaties of Dublin, which regulated European asylum laws, actually mandated. And that would have been the first time a refugee enters any European country, that country is responsible for him. And then we can talk about transferring him. The way it works at the moment is that, for example, Greece has no power to take up 1.5 million inhabitants. They have economical problems beyond imagination. They are almost bankrupt, and they just got away from state bankruptcy last year. So there is no money to take in 1.2 million people, give them shelter, housing, and jobs maybe even in the future. So what they have understandably done is to say, well, we take a big part of them, but we can't take everyone, we can't protect the border. So the people migrated on and created their own asylum system, so to say. And Europe has been completely overwhelmed by this. Typically when these people arrive then in the country where they would like to be, they undergo a basic registration, which involves biometric scans, fingerprints, identification, and then they undergo a basic medical exam. So they are basically introduced into the general medical system, and then they are in an asylum center or in small-scale housing, and they have full access to healthcare in Europe. One of the most beautiful things that happened during this whole reception over the past months is that it had led to an enormous resurgence of civil society in Europe. Europeans, I think by and large, I would like to be corrected by other speakers if they think differently, Europeans were used to the government institutions thinking for them and acting for them. And healthcare was something that no one even bothered about because it was guaranteed anyway. So healthcare and insurance is not an option. Everyone is insured anyway. It goes away directly from your salary. You never even have the money in hands. You get full coverage for everything, and that's it. And you don't think about it. And so when all these people came to Europe, suddenly we were faced with the thing: how do we deal with them? And we found that the national systems, especially of the countries closest to the immigration, that were the first ones to really take them in, like Austria and Germany, were actually totally inadequate to deal with suddenly hundreds of thousands of new patients. And what this resulted in was huge initiatives by private people that I would say is very American. So people took this into their own hands, and people started small medical services. They started medical outreach team to go to the asylum camps, and they really tried to make a difference there. And I think that is maybe one of the biggest positive things that has come out for Europe, apart from being able to help, is to have this resurgence of people taking things into their own hands and say, if the government is not able to do this, then we'll do this. Before, civil society in Europe basically meant the state has run out of money, we can't do it anymore, so you need to do it. But civil society in the good way would actually be that the state says, we maybe even don't collect taxes for this, you can do this in your own private sphere, and that is what's resurging now. When we look at the burden, I briefly talked about one of the most important things that we need to consider when we talk about the refugee crisis, or the reception crisis as it was called, is that the burden among the 500 million Europeans to take in refugees is very differentially shared. Of course, Hungary was very much affected last summer, and they have not been able to solve the problem effectively, but so that is a static problem, and the rest are dynamic problems. So Hungary does not take in any more asylum seekers. They have built a fence, and they say, we'll deal with these people no more. And they have gotten a lot of criticism for that, but that is, unfortunately, in the absence of a coherent strategy, one way to go. And other countries like Sweden, Austria, and then of course Germany have also taken a large share. And these shares are not static, they are growing every week and every week. And so you see the EU average, so 255 people per 100,000. That should be a doable number. That is 0.25%. That is something that any country should do. But the effect is that there are also big countries like the United Kingdom and France that have practically not taken in any refugees now. So that increases the burden on the more Central European countries. And the problem that we're dealing with is a global one. As Dr. Robinson said correctly, these are global problems. This is not something just relevant to us. The number displaced by war, the number of people has reached a new height last year, and the year before about 60 million, and it's growing every year. And the people displaced each day by war is also about 40 to 50,000. These are the newest numbers by the United Nations. So 50,000 new people try to flee every day as a result of war. And the most important thing is that there is like a centering of the most important of these conflicts in the Middle East and in Africa. And the most important one is, of course, Syria, which has led to 11 million displaced people. And when we talk about European refugee crisis, we underestimate that we have taken up 1.5 million people, but this is just the share of the Syrian people. So actually the countries that are really, really struggling with, and that would also need a lot of support, are countries like Turkey. They have more than 2.5 million Syrian refugees in their borders, in camps along. And Turkey, I think, does a very good job, the best they can, to help these people, but it's 2.5 million people in a country of 80 million people. So this is quite a large number. Jordan is a country with about 10 million inhabitants, and they took in 1 million. And Lebanon is a country that just got beyond its civil war, has a few million people, and they took in almost 2 million people. And if you look at the light shaded gray numbers, these are the number of children among the refugees. This is heartbreaking. It's almost 1 million children living in refugee camps here. This is really a lost generation. And how did this evolve? How do these people come? Well, the traditional route was to cross into Spain and into enclaves like Medea that are on the northern African continent, or to go by boat to Italy. But this per year were relatively small numbers. Nevertheless, the European Union left Italy alone with this, and also Greece. But these numbers were still doable, maybe. And you could still distribute these people according to the European Asylum Program, which is the Treaty of Dublin, meaning that Italy would take them in, and then they would be fairly distributed throughout the European Union. But even that didn't happen too good. But still, this was a number that they could deal with. 1 million is impossible to deal with. And what the biggest influx was then was that people came into Turkey, and you know that there are 2.5 million people or something waiting in Turkey for better times in Syria or in Europe. The World Bank lost some of its funding, also from European countries, so they couldn't provide for the people as well there, and the people started moving. And so the people went from Turkey to Greece, and this is a notoriously porous border. So that Greek islands are just off the coast of Turkey. So if you make it there, you have the right to apply for asylum in the European Union. And many, many people have taken that voyage, and many have unfortunately died. And so if you look at the migrants, the tactic, you see that there is a Western Mediterranean route which is almost insignificant. Then the eastern borders, like coming from Europe or Russia, is almost insignificant. Albania to Greece is insignificant. And the ones that have really skyrocketed is the Eastern Mediterranean and Western Balkans, so this route to Europe. So this is where most people come. And if you look at this long voyage that these people have to undertake, you see that there are enormous healthcare problems that these people face. And you all remember these pictures from last summer. This was when people were flooding across Hungary also, and towards the border to Western Europe. And there was this enormous tension and unease, and you think, we can't let these people stay in the middle of nowhere. Then the borders were opened sometime in May or June, and people organized this, so spontaneous cookings were organized for people who came, to give them food, to give them shelter. And somehow it was the notion was that if only Austria, Germany, Sweden would open up their borders and would take in the refugees, the other countries would join in as well and say, we'll take some as well. And that hasn't happened. Then Hungary was the first country to say, like, if no one takes our refugees, we won't take refugees again anymore. And they created a physical fence that makes it impossible to cross into Hungary. And so Hungary has practically shielded itself off. If they say, if we don't get any help here, we're not going to do it anymore, which is a very populistic and right-wing thing to do, but very popular with the Hungarian people. So then people diverted across Croatia and Slovenia to Austria, and this is the way that most refugees come to Europe at these times. And then they continue to Austria, to Germany, and then to Denmark and Sweden, and even Sweden and Denmark have now said that they can't take anymore. It's over. And Sweden has 8 million inhabitants. They have taken in 200,000 refugees new in the last half of the previous year. So even Sweden, as maybe the most liberal and the most immigration country, says it's over. We can't take anymore. And so the European summit that is taking part this week and next week is really felt to be a very decisive turning point. Will the European Union get to grips with this or not? So a little bit more now towards the medical side. What are the medical problems? What are the demographics of the people coming? In the beginning, it was mostly men, but now we're seeing increasing, you see as the time goes by, now we increasingly also see families on the way with women and children. Where do they come from? They come from Syria and from Iraq, some of them from Afghanistan, and less from other countries in the region or North Africa. And if you look at the peaks, this is nothing that's first. This is not a first in human history. There have always been big shifts. There have always been refugee crises. This was, for example, sparked by the Yugoslav wars in the 1990s. So even then, Austria is now taking in 80,000 people. Even then, Austria took 250,000 people. So more than we took in now. So this is not a historical first. And Europe has dealt with this before. Just this time around, it seems to be very difficult to get a consensus. And one of the problems is also that far fewer refugees were able to return home or to safe third countries than in previous years. If we look at 2014, like in previous years, you could still negotiate with countries that, like Jordan or like Syria, like Syrian neighboring countries like Turkey, to maybe take back some of the refugees, to help them, to give them money for refugee camps, for schools, for food. And this works increasingly bad. So lots of the also Northern African countries and Middle East countries are turning off the ties and saying, we need more help, otherwise we're not taking anyone back. And what is the health status of these refugees? What creates the challenges now? It's that during this whole visit, this whole period, of course, they were on the way from weeks or months. They had very limited access to health care and poor living condition. They were lucky if they got water somewhere, but most of the time it was really taking the last possessions and making it somewhere. The weather conditions worsened. These people were all on the way in winter. You have to imagine these were tens of thousands of people on the way with inadequate clothing from the Middle East crossing European winter. So they were really relying on help. And there were outbreaks of communicable diseases, maybe in some refugee camps in Turkey, but there is very limited information on the health situation of the refugees currently in Europe. There are estimates. There are estimates on how people are doing in their home countries, like what is the state in Syria at the moment. And you see here that Syria has 17 tuberculosis cases per 100,000 patients, which is much more than we're used to in Europe, obviously, but it's not staggering high, and it could be much worse. So these people have healthcare problems, and that's why you really need to screen them and take them in very efficiently. You cannot just take them in. There is only 1 or 2 studies that look a little bit at what the asylum seekers' needs are medically. And one of the studies from Köln, from a large university hospital, and they looked at 880 consecutive refugees who were screened and who presented to the emergency room there. And you see that that is typically very young people. So the median age is 34, so it's typically young people. Most of them are from Iraq and Syria. And the reasons for presentation are just medical, surgical, or psychiatric in the most part of cases. But it's typically also not the most healthy patients. So 10% of them have serious comorbidities. And the comorbidities they typically have are like ENT, gynecological, and dermatological. And if you look further beyond the initial presentation, they do have like psychosis, somatic disorders, addiction disorders, or depression. A large number of them, 30%, when they were screened, had signs of post-traumatic stress disorder. And more than 30% were in a psychosocial crisis. And we're not talking about a life event here. This is a triple life event, fleeing your country, losing people. And I also had the opportunity to talk to people, to one refugee who had lost a leg and who had the fortune of having it replaced by a provisional prosthesis where he lived. His two brothers had died, and he was lucky to get out with his daughter and wife. So he just barely had saved his life. But what this man had gone through, losing close family, losing two brothers within weeks in hostilities, that is something that we can't even really imagine living here in the West. And we haven't figured out how to deal with this. There are no estimations, for example, of how many new psychiatrists we need, of how many psychotherapists we need, how many psychologists we need in Europe to even begin to deal with this massive problem with hundreds of thousands of patients with psychosocial problems that really, really need to be dealt with. One other problem is that, of course, these people come from countries where they were in contact with sanitary conditions that were not optimal, to put it lightly. So many of these patients carry multi-resistant bacteria, which is another threat. So you see here that the typical ratio of multi-resistant bacteria, and this is University Hospital in Düsseldorf, if I'm not mistaken, it's a large German teaching hospital. And this was 147 refugees that were systematically swabbed. And they said that usually the rate in Germany is about 10 to 15% of multi-resistant bacteria. I think it's slightly lower than in the States. It's a little higher. You have a higher MRSA rate, for example, but this is quite okay for European standards. And they have 4 times that ratio. So you need extra precautions. Even if they come into hospital care, they need isolation. They need to be on specialized units, in specialized rooms, which makes care more cumbersome and more complex. But what the bottom line is that refugees do not currently represent a threat to Europe by their being there. They are a priority group for communicable diseases prevention, and the control efforts are needed because they are more vulnerable. So they typically are housed in larger groups, and in larger groups of people with health problems. So they are a priority group, but it's not an undoable problem. The risk to European residents of being affected by outbreaks among refugee population remains extremely low. And one of the main arguments of right-wing politicians was also we cannot take in that many people because they may bring all these sorts of illnesses with them. And this has turned out to be completely unfounded. I don't think there is a single case where there is an outbreak of a communicable disease among Austrians or Germans or Dutch people because a refugee brought something with him. There is no single case. There are refugees who come with diseases, but they are typically well treatable. However, they are a group with distinct and partially unmet medical needs, and some of the problems are medical. A large part of them is psychological, and also we haven't even begun to assess and deal with the problem of sexual violence that these people had in the home country on the run, and that also continues in refugee camps, and some carry multi-resistant bacteria. What are the challenges that we face at the moment? And this is not challenges that we thought of. We didn't even assess that. This is information from Australia. These are, so to say, the Australian guidelines to deal with refugees. We have none in Europe. The first thing is economics and unemployment. So we, as a challenge for healthcare and social care, these people are somehow removed from our society in that they don't really speak the language. They sometimes have a different alphabet, so they really need to be integrated in a very positive way. Still, they will face unemployment rates that maybe is much higher than the native people, which makes it difficult to assess or to access the whole bundle of health and social care. Also, there are cultural perceptions of maybe the people who come. These are people that are typically not used to universal and unconditional health care. So they may be barred from really going there because they think it's not possible. And there is missing intercultural competencies also on the part of healthcare workers. And there are lots of people who are coming, for example, who are devout Muslims, and for whom it is not acceptable that a male doctor investigates a female patient, just like that, alone in a room. So they have needs that we must meet and that we must accommodate, that we must cater to, that we must accept, to really treat them as human beings that deserve the whole respect. There are language barriers, so we need interpreters. And basically that would mean, because they are spread all over the countries, that would mean that every place they would possibly go to would need to set up interpreting services. And that's almost impossible. So every doctor's practice, everyone they could turn to would need an interpreter. So we need to create some sort of system, and even if it was a telephone system. We haven't even set up a telephone system. Like many American hospitals, you have such a diverse population. You have a telephone directory. You can immediately connect with an interpreter. We should set up something like this in Europe. We don't. We have an undertrained healthcare workforce of what it means to care for people from, for example, the Middle East. So many people from the Middle East have just cultural wishes, as I just said, male, female, people about body integrity. They're totally different from European patients, from the typical European patients, and we need to train the healthcare providers who work with them. There are legal barriers. So one of the very, very big problems is that when the borders were opened, initially, I showed you pictures, you saw just waves of people marching towards Austria and Germany, and they were welcomed and they were registered, but by far not all of them. So Germany has taken in about 1 million registered asylum seekers, but they say that a substantial 6-digit numbers, between 100 and 300,000 people are in Germany that no one knows of. No one knows where they are, no one knows who they are. And certainly they have a very limited access to healthcare, because going to healthcare would mean that they need to show ID, and otherwise they will be registered, and they may not want that. KH is an Austrian abbreviation for district hospital where I have ties to, and this is like a typical peripheral hospital in the country, in the mountains, in a very idyllic place. And they say that they now have procedures in place to deal with the many refugees that come, but they have so many people who just show up without ID, where I think, where did they come from? This is far away from the borders, hundreds of kilometers away, and every day they get patients that no one knew were even in Austria. And 3 weeks ago, they even had someone who was on the most wanted list for being a terrorist. So he came because he was wounded. No one knows where he was wounded or why he was wounded. And he ended up in a small district hospital in Austria, and they ran the ID. They said, we have to register you, and he was in such a diseased state that he let everything be done with him just so that he could register and could get health care. And then they forwarded the photo to the police, and suddenly there were 10 policemen in the hospital and said, we'll take this guy along when you're finished with him. He's internationally wanted for being an IS terrorist. And that's someone we didn't even know was there. So he just showed up by chance. So this creates huge, huge problems. And also we need resources to achieve a holistic care for refugees. So we need to look at this positively. It's impossible, it's not conceivable that a rich, affluent continent like Europe cannot take in 1 million or 2 million people and care for them adequately. But what we need is, we need to know what the people need, and we currently don't. We need to know what we have to invest medically and socially to really make the best of the situation, to make this work, and to say, this is the resources, this is how we're going to allocate them, this is where the resources will come from, and this is how it will play out. And I would love to show you a graphic how this is planned. There is none. And so this is one reason why this huge wave of enthusiasm, I think, is one of the reasons why this huge wave of enthusiasm that Europeans had to take in the refugees last summer, it has somehow crumbled. And people are taking in extra hours. Volunteers are working extraordinary amounts of time in their free time, on weekends, in the evenings, next to their normal work, and doing, hoping that at some point the public system will pick it up and relieve them and say, you did a great job, we'll continue now. And it doesn't. It only very slowly and incrementally happens. And there have been outbursts of public support for refugees wherever they came. They've been really welcomed, and somehow people even took to printing flags with refugees welcome, so really spreading this motto, refugees welcome, all over Europe. People were helping them when they arrived, and people were organizing really big like support concerts to drive money, to get money, and to make charitable donations to refugee camps. But somehow people are becoming a little overstrained. And if you see it, this one here, this one says FPÖ raus, which is the right-wing party in Austria. They said, you get out of this country. If you don't want refugees to come, you get out of this country. And somehow the tide is shifting a little bit because the governments are not picking this up as adequately as they should. So you have pro-German, pro-Austrian, pro-Dutch thing where it says it's our country, we don't want to spend the money on refugees. But I think it's less that the people are afraid of refugees, it's afraid of that there is no plan how to deal with them. I think that would make a big difference. The reaction of these people has been very extreme in some parts of Europe. This is so it says here, stop Islamization of Europe, as if these people had come to invade us or something, but they're just running for their life, and even depicting Mrs. Merkel with a headscarf. So this is really, and this is nowadays accepted, halfway accepted. If you had done this 2 years ago in Germany, you would have gone to jail for a number of political laws that exist that prohibit you from being politically incorrect in the right-wing sense of the term. And now this is just public discourse, and it's accepted. And this is one of the signs that Europe really needs to get its act together to make this a constructive policy. It has been said that we live in an age of mega crisis, and in Europe we have been a little hit by some of them. We had the financial crisis, we had the euro crisis, where it wasn't sure whether the whole monetary system would collapse 1.5 years ago. Now we have the reception crisis, where we say we don't figure out how to deal with these people, and these levels of humanitarian needs have been unique since the Second World War. I think it is also an opportunity for Europe to rediscover what it was worth for. We have become a very complacent and hedonistic society, so I think all these refugees that come really force us to think about what are our values, what do we want to be, what do we want to stand for in the world, and how do we make this work? How do we make these people feel welcome? How do we integrate them? And how can we make this work in the long run, like 20 years down the road? I'm very optimistic that Europe will get there. I'm very, very optimistic. I would have loved to show you all the graphics, how this is planned and how this will work out. And I sincerely hope that the next few weeks will bring a little bit of clarity about how the European Union will tackle this problem, that we will inventorize and determine the needs for the medical and social service that need to get in place for these people, and that we will make this work for everyone to save the refugees from their fate and to make them good, valued, accepted and happy members of our European societies. Thank you so much. Yes, please.
You indicated that if you're a registered refugee, you get free health care.
Yes.
So, and everybody else that's a citizen of that country doesn't paying for that health care
Yes.
for the individual.
Yes.
So how is that not breaking the bank from a healthcare cost perspective, for the citizens versus the refugees, especially as refugees have a high incidence of comorbidity and those sort of chronic ailments and those.
Yeah, I looked a long time. I looked again yesterday. We don't have any really official numbers, so it is. I think I'm not sure whether it's some sort of avoidance politics in Europe that people don't want to say, look, this is going to cost billions of euros. Let's be honest about this. But on the other hand, let's be honest, we are like Austria is like the 7th most affluent country in the world. There are people who need the money more desperately than we do, and we can still have a very nice standard of living and do the right thing. But I think it's a really, really avoidance politics. So the European population and also the national populations have never really gotten the hands down on what it will cost. There are no official numbers, and the only country that has somehow estimated the social cost and the healthcare cost is Germany, and that's in the billions per year. So it's in billions of extra expenditures per year. And for Austria, the unofficial estimates are that it will be, for a country of 8 million, it will be about 2 billion euros extra for the social and healthcare services per year. So that's 0.5%, between 0.5% and 1% of the budget, of the gross national product each year that will need to be allocated to this. It's about the budget that we currently spend on education. Again, so that's the size of the size. So it is a huge thing, but I think rather than avoiding talking about this, people should like face up and say, this is what it's going to cost, and it's an essential question. This is not something optional. This is absolutely quintessential for us, and it's vital for us that we handle this problem well. Otherwise, we create a group of people living with us that are permanently disadvantaged, as opposed to Austrians or Germans or Dutch people. And we worked 70 years to not make that happen, and now we're letting it slip. So I think this is vital for our society to handle this constructively.
I hope everybody can hear me. I just want to applaud the values that you have articulated today, and also say how it's made me stop and think about what we can do, what I can do here in the United States. So thank you.
Thank you so much for this. Thank you so much. I think one of the things that we realize we need to make a good job at home in Europe. We need to be very aware that there are countries who are also struggling, like Turkey, who are always left out of this equation. They are not seen as having a refugee crisis. They are not like but they still carry a huge part of the load, or Jordan. And these countries have seen the help for them. Until last summer, they saw the help for their countries decline rather than increase. So the World Food Bank, for example, was caring for a lot of the refugees along the border in Turkish camps. But most European countries have decreased the money that they actually allocated. And I'm ashamed to say that Austria halved its contribution. So they made it physically and financially impossible for the helping organizations to provide the adequate care where the people needed it the most. So I think this spans much more. So rather than, with all the peacekeeping initiatives, and very complex. Thank you so much.
We have time for one more question.
So clearly there's a big difference in healthcare status in Europe and here in America. So what are some strategies that are being implemented to convince people of other countries to help with that situation of the refugees versus our at-home crises?
You mean how we try to get more solidarity in Europe to...
Yeah, for us, what ways are you guys implementing or convincing people from other countries to help with the refugee crisis in a different country?
Other European countries.
Crises here.
Other European countries, you mean? Yes. So that is very difficult because the European Union was actually built on the principle that you cannot force anyone to do anything, and you can basically, the treaties need to be unanimous, and then there are some countries that can opt out, but you cannot force someone to do something. For example, with the euro, Sweden said we want to keep the krona. You go ahead, we keep the krona. You couldn't force them. Britain kept the pound. Britain may want to leave, but we can't force them to stay. So this is unfortunately, this is luckily the way Europe was set up, and it was very well equipped to deal with like chronic problems, with big policy issues, with breaking away the borders within Europe. But it has unfortunately proven unfit for these acute crises where you really need to solve within months huge questions. And now there are cultural differences. I think there are cultural differences that people in the Eastern European countries are struggling. France already has social problems that are enormously complex, and you got the news from Paris twice last year. So that country is really that country really has a lot of problems on its own, especially also with immigrants who then become disadvantaged, who end up in disadvantaged society segments, and who are then a breeding ground for many of the problems that have appeared. So it's almost impossible. It's almost impossible to force them. The ideas that have been put forward is that there is a large part of Europe is funded upon distributing money from the richer countries to the poorer countries. So countries like Austria, Germany, Holland are net payers. I mean, they still receive funding for some projects, but they pay much more into the pot than they get out. And one thing that they are thinking about now is that every country can declare the costs of refugees to that pot. And so this reallocation pot will fund the refugee crisis. And thereby you will indirectly punish the countries who are not taking in refugees, because there will be less money to fund their projects and they won't get anything for the refugees. So you take away the funding, the active funding for many of the projects from the countries who are not willing to cooperate. But that's almost like coercion. That's starting to be a little criminal. It's like really bribing the people into taking people, otherwise cutting off the financial support.
So has there been any questions of asking for America's help?
No, I think not. I think President Obama announced that 10,000 people would be taken in, and I think that Europe does not expect the States suddenly to take in 1 million people. I think that's
not taking them in, but helping to provide our services over there.
I think that what Europe would be looking for, my impression, personal impression, what Europe would be looking to the States for, is to help stabilize the situation. But it's become more and more complex. So the question is, can you do that? But I think more the guidance in the region to make the situation better at the site where things happen, or in the surrounding countries, taking influence on Turkey as a key ally of the United States, and making things better there. I think that would be one of the things that Europe needs to invest more in the UN, and maybe also America would have a great role in. And to solve the Syrian conflict, I think that gets more difficult by the week.